The last one is the key of maternal and child health is we're really trying to talk about the life course. The life, in other words, instead of thinking individual events, individual outcomes, it's a collective of what we do for our children and our future generation that has the greatest impact. And I love it that we figured this out in the United States. Europe figured this out probably 20 or 30 years ago. But the whole idea is that we really need to affect the overall life experiences to improve outcomes. And so the question comes back with perinatal quality improvement, can we really affect the life course? And so we've had some very simple things, nothing manicured, but I just walk through them. When you think about life course, one of the easiest things to do is to think about growth. Here's WHO standards for growth. This is age for weight, just to show you how much weight is gained over time. I'm doing this to emphasize, if you see the biggest growth period, you see that what happens between year and between two is important. What's connected to this growth is it's not just weight that's being added, not just length, but it's added brain development and a variety of other pieces. In fact, if you shift that growth curve now and only look at the first 2 months of life, it's also important to notice that yes, growth occurs across that too, but look what happens in just the first couple of months and how accelerated that growth is. And if you take that now back to gestation and what happens from conception to birth, that growth happens really rapidly. And in here you'll see the whole series of organs that occur at certain time periods. In infant size is when birth defects take place, but the point I'm trying to make here is when we talk about growth, it's not just size, it's development. It's organ development, and the most important, the last one that's really here that's important is brain development and how much is occurring. That's why early delivery is important, because you can see the size of the brain and the shape of the brain, the maturity of the brain at 36 weeks, and you compare that to 39 weeks, and there's a massive difference. So from a life course perspective for the individual child, what really happens in those 9 months of pregnancy and what happens in that first year of life has major implications, not only on that child, but the whole trajectory of what that child goes. If you go back to the work by Michael Liu and Neil Holofon and others, this is just their example of the life course. You can see the rapid growth that occurs from their perspective on these life courses right prior to pregnancy, during pregnancy, and then across, and then the intergenerational effect. So that it's really key. So why is perinatal quality improvement? Those value adds that John talks about, those quality improvements, think about it with the line infections. One of the problems with line infections is meningitis. Those children get meningitis, have tremendous mental disabilities that are lifelong, that really affect where their courses are. John talked about the cerebral palsy connected with early delivery. There's also data now to show learning disabilities. So mothers who decide to deliver those babies early, or the doctors, are also not only affecting some in terms of mental retardation or disability, they're actually going to affect the learning processes of their children so that we can have a long effect. And just think about when those children then start having their children and what that impact is. So we wanted to spend a few minutes to just highlight that